You are listening to the Move the Dirt podcast. The information provided in this podcast is for educational purposes only. It is not intended to provide medical, legal, or any other professional advice. You should always seek advice from an appropriately qualified and experienced professional.
Hello everyone, thank you for tuning in. Today I am joined by Dr. Rachel Brown. Rachel is an NHS consultant psychiatrist. She is also a functional doctor. I understand she has an interest in quantum biology, which I'd like to get into later. I've actually personally been following Rachel's work for some time. You can find her on Instagram at Carnivore Shrink, which I think is an absolutely fantastic name. But we'll get into the fine details later on. So Rachel, thank you ever so much for joining me. As I say, I've been watching your work for a long time now, and I was absolutely blown away when I got the opportunity to speak with you today. So thank you for joining me.
Thank you.
May I ask you to start by introducing yourself to the listeners and telling us a little bit about yourself and the type of work that you're involved with at the moment?
Sure. Yeah, so I'm a traditionally trained doctor and I've worked within the field of psychiatry since 2004. I'm obviously well versed with all the standard treatment protocols and the standard approach within mainstream medicine, but I've always had somewhat of an interest, a rather large interest in holistic health and natural healing. And so over the years, I have diversified, I suppose you could say, my skill set, partly because of personal health experiences and partly because of health experiences of loved ones within the family and friends. So I have a bit of a dual role at the moment. So I still do some NHS work. And in that capacity, I started the first metabolic psychiatry clinic within the UK. And it still is the only one that I'm aware of. And I've been involved in some research looking into the use of ketogenic metabolic therapy for treating major mental illness locally within Edinburgh in the academic department there. And then my other hat is working more along a functional medicine, integrative medicine approach privately. And more recently, I've delved into the whole field of quantum biology, and I'm now board certified in applied quantum biology. So that brings another strand to my approach with clients.
So you're a very busy lady then.
You could say that, yes.
So I actually find it very interesting that you're a conventional clinician, if I can use that terminology.
So do I.
You're also a functional doctor. Now, in my professional life, I deal with lots of doctors, lots of surgeons, and I don't think in the last perhaps 25 years I've ever come across a doctor who is both conventionally trained and trained as a functional doctor.
Okay.
So may I ask why you touched on it being your own health experiences? Was that primarily the reason for you wanting to study functional medicine as well?
Partly that, yes. So that was a big motivation and driver for me. However, I've just always been a person who asks questions. I've always wanted to know why something is happening for somebody, and I've always wanted to dial down into what are the underlying reasons why somebody might be experiencing certain symptoms. And I suppose coming from a bit of a critical thinking approach, I've been somewhat frustrated at the way I've had to practice within mainstream psychiatry. And so it's been a combination of my own health experience and trying to solve and optimize my own health because of certain family history diagnoses that ended up coming to pass. And I suppose that's just led me down the path of nutrition and lifestyle optimization to reverse symptoms of all sorts of different disorders or diagnoses, not just mental health, but physical health as well, and to bring a bit of a blended approach to the advice that I give to clients that I work with. I don't know if that's a bit vague, but
No, no, not at all. And may I just ask, could you clarify for any of the listeners who are perhaps not familiar with functional doctors, what a functional doctor actually is, and what are the differences between going to see a functional doctor and a doctor practicing within the conventional medical system?
Yeah, so there is a field called lifestyle medicine as well, and I suppose functional medicine overlaps somewhat with lifestyle medicine. It's just a completely different paradigm and way of looking at symptoms. And there are various more sophisticated tests that can be done to try to look under the hood in terms of what's happening with somebody's health. So more tests than would be available in the NHS. However, there's quite a range of approach of practice within functional medicine. So I probably don't align entirely with what I think would be the majority of colleagues practicing functional medicine in that I don't rely very heavily on testing. I think it has its place and its role, but I'm very much about trying to get people to just get the fundamental basics right in the hope that they're not going to need all this additional expensive testing to try to narrow down what's actually going on in their body. So it's, it's hard to explain.
So, am I understanding correctly that a functional doctor is looking at more perhaps at causes, and conventional doctors are looking more at symptoms? Would that be a fair statement?
Yeah, so the way I view my mainstream medical training is very much that I was taught to group symptoms together to make a diagnosis to then inform a drug treatment protocol. Although within psychiatry there are other disciplines and other professionals who form the multidisciplinary team. And so there's obviously psychological treatments and occupational therapy interventions, and there might be physiotherapy interventions, art therapy, other disciplines. But certainly from a doctor's perspective, I was very much trained in making a diagnosis to then implement a drug treatment protocol. Whereas within functional medicine, I'm asking more the question of why is somebody presenting with these symptoms? For example, how much inflammation is underlying the current level of symptoms, and where are the sources, potential sources, what's driving the inflammation? It's essentially just asking the question why.
Because I have had one experience with a functional doctor in the past. I'm anticipating that the listeners may not be very familiar with functional medicine, as was the case with me until a few years ago. That I had an experience where I had a persistent cough from the age of roughly around 20 years of age. And no matter what I did, I couldn't get rid of it. And I was back and forth between the GP and the hospital. Over the years, I've been given various medications. They suspected asthma and then lots of other different things. So, and then I was probably about 10 years ago. So this I've just turned 50. So we're sort of in a position, probably this is going on for about 20 years, and I was getting no better. And then I experienced a sort of sudden decline where I was just feeling awful. And my wife and I were desperately trying to find someone to go and see. And it was my wife who actually came across functional medicine and said, there's actually someone called a functional doctor. And I said immediately, what's that? And she said, well, on the website of the doctor, they're saying that a functional doctor is a clinician who looks into the causes of a condition. Now, at the time, I was somewhat green to that concept, and my immediate reaction was, well, don't all doctors look at the causes of a condition? And then my wife said to me, look, you've been quite poorly, you're getting worse. What have you got to lose? Let's book an appointment. And I have to say, I was absolutely blown away. It's obviously privately funded, so you're obviously paying for a professional's time compared to a GP who's maybe got 5 or 10 minutes to see you through no fault of their own. It's the system that they're working within. But I was absolutely blown away because the initial consultation lasted an hour and a half. And from the very start, the doctor went into such details as, were you a natural birth? Were you cesarean section? Were you bottle fed? Were you breastfed? And cut a long story short, after suffering a condition for what amounts to about 20 years, within 2 days of seeing the doctor and adopting the protocols that he recommended, I felt like a completely different person.
Yeah.
When I was in the appointment, he was the first clinician that had said to me, describe to me how you feel. How does this make you feel? And I remember feeling somewhat embarrassed because I said, doctor, if I was being very open and honest with you, I would say that I was being poisoned. That's how it feels.
Right.
And he pretty much said the effects that you are experiencing are possibly similar to a poisoning. And it turned out to be that I had an allergy to milk, and I also had a mycotoxin issue related to mold.
Oh, I've had a mycotoxin issue, so yeah, I know all about that.
So absolutely, it's completely different. Now, one of the other things I'm aware, Rachel, from following your work, and I heard it in an excellent podcast that you did with Zoe Harcum, and we love Zoe.
We do.
So I listen to all her work. You mentioned that you yourself had got into the ketogenic way of eating through trying to optimize your own health, and you also mentioned that you had a sugar addiction.
Mm-hmm. Yep.
Perhaps like lots of people have, but perhaps don't realize. Could you tell us a little bit more about your own experiences and why you chose the ketogenic diet or ketogenic way of living and how you feel that's helping you?
Yeah, of course. So I've probably been in the low carb scene for over 20 years at this point in time. However, I didn't really fully realize it until the last 10 years or maybe just slightly less than that. But what I'd actually been struggling with since my teens and all throughout my 20s and a lot of my 30s was a raging sugar addiction. So for many years, I just thought that maybe I was an emotional eater because I was aware I had difficulties controlling my sugar intake at times, not all the time. And I would go through periods where sometimes it was worse, sometimes it was better. And I think it was in the early 2000s when Atkins was really popular. It was an uncle was over from the US, and he introduced me to Atkins, and I read his book and was really convinced by all of that. And that was my first foray into the low carb world. But I ended up using a lot of the meal replacement, sweeter products in Atkins, and I always just fell off the wagon and ended up not being able to stick consistently with a very low carb approach. And that continued for a number of years on and off. I've been following Mark Sisson for many, many years. So I'm thinking more along the lines of ancestral health and what's appropriate that way. So it's a shame. I just recently discovered that Mark's Daily Apple website is no longer there, but that used to be such an amazing resource of all sorts of varied health information. Anyway, he and his work brought the ancestral health perspective to my attention. And for quite a number of years, I followed a primal diet, which is like a variation on a paleo diet. So whole foods, ancestrally appropriate, but a primal diet would include some dairy as opposed to a paleo diet, which would usually exclude dairy. And I got on fairly well with that. And then it was a diagnosis of a progressive neurodegenerative disorder in a close family member that then made me think, well, I'm low carb, but I'm not really doing a seriously ketogenic version of being low carbohydrate. And just in terms of my own risk and thinking about genetic risk, that's really what motivated me to embrace a ketogenic lifestyle. I had so many health benefits from that, one of which was a significant improvement in my sugar addiction symptoms. So when I undertook a ketogenic diet, that's what really gave me a fair bit of food freedom. And, I'd gone through a stint of being vegan for about 18 months. And this was back in maybe 2009, 2010. I always forget the dates. And at that point, I did that for 18 months and my health was just at its absolute worst during those 18 months. So, we can talk about that if you want to,
Right.
But anyway, I was just aware when I went ketogenic and reintroduced animal foods that my health did considerably improve.
Right.
And then it was, gosh, it's coming up for 6 years ago now. There was a ketogenic influencer whose work I really respected a lot. So Vanessa Spina, known as Ketogenic Girl. So she's really up on her data and sports performance and body optimization, and has published a number of meal plan books and programs and has some other products. And I really respect her as a person and her thinking around this subject. But anyway, she happened to post an experiment that she was doing, and it was a carnivore plate of food that she put on her Instagram account. And that was my first coming across of carnivore as a concept. And anyway, I was just curious. And it was curiosity that made me try carnivore more than anything else after watching a talk by Michaela Peterson and her health journey, and then watching a talk by Sean Baker that he had given that's still available on YouTube. So those two videos just made me so curious that I thought, I'm just going to have to try this. So I just immediately delved into trying a carnivore diet and never looked back, essentially. So carnivore brought me complete food freedom. So carnivore was the final step in completely eliminating any noise or sugar addiction or any kind of compulsion around food. So even when I'd been ketogenic, there were certain foods that were still slightly problematic, one of them being nut butters.
Right.
So there was something a bit compulsive about that for me. And it wasn't like I was really majorly overeating it, but I was still aware that it felt a bit out of control. And like there was a bit of a dopamine response from that, because that's what happens in addiction, hijacking our dopamine receptors in our brain. But anyway, carnivore just brought about complete food freedom, but then even more health improvements. And at the point of deciding to try carnivore, I wasn't aware that I had any particular health issues. But in retrospect, my athletic performance improved, my body composition improved fairly quickly. You know, for example, when I say athletic performance, I'm meaning strength in terms of being able to do push-ups. I could do more within 2 weeks of carnivore than I'd ever been able to manage previously in my life. And there were various other health issues, like niggly issues, like coming down with the common cold. I just didn't get sick for probably the first 3 years of being carnivore. And that was all throughout 2020 to 2021. So I kind of delved into carnivore from 2019. And there have been so many improvements in that personally. And then I'd also come across someone on social media who had been through the psychiatric system in the US and had very major depression, so a very severe form of recurrent depression, had been through all the standard drug treatments, hadn't had ECT, although that had been discussed with him. And he had tried a ketogenic diet, but for him, it was a carnivore lifestyle that actually resolved all of his chronic symptoms of depression and anxiety. And no drug treatment required. And so that also really piqued my interest in terms of the different nutritional options for people who might be dealing with mental health symptoms.
But was it your own interest that led to your metabolic clinic within the NHS? Because as you mentioned at the start, you believe it's the only metabolic clinic.
Yeah.
Could you explain to the listeners what metabolic health is, and why it matters?
Yeah, sure. So, I mean, one of the most common metabolic problems these days is type 2 diabetes or pre-diabetes. A lot of the chronic health conditions that we live with these days relate at least in part to having very high levels of insulin, with insulin being a storage hormone in the body, but insulin's main role is to reduce your blood sugar level, your blood glucose level, because having levels that are too high are toxic to the body and cause major dysfunction. And we know that people can have high levels of insulin for a decade or longer before they eventually develop type 2 diabetes. And we refer to this condition as insulin resistance. So what happens when your levels are very high for a long period of time is that cells in your body and your brain eventually become resistant to the effects of insulin. And what this means in the brain is that glucose is the main fuel source in the brain, and you maintain a constant proportion of glucose in your brain relative to what's in your bloodstream. But if you have insulin resistance, it means the cells in your brain can't access the energy from glucose because insulin is required to free up that energy and make it accessible. And so you could essentially have a brain that's swimming in glucose but unable to access that energy. Essentially, when you have an energy deficit in the brain, this leads to all sorts of cellular dysfunction, inflammation, and neurotransmitter imbalances. And this is what appears to be responsible for a lot of the symptoms of different mental health diagnoses that we have. So this could be poor concentration, it could be brain fog, it could be anxiety, depression, it could be psychosis even, it could be dementia. And so dementia has been referred to as type 3 diabetes by certain researchers, and that's been known for quite some time at this point.
If I came to see you as a patient, would I elect for the metabolic clinic or conventional clinic, or do you as the consultant psychiatrist determine or possibly give me the option? How does that generally work with your patients?
Yeah, so I work within a crisis team in the NHS, which is a slightly different role to a lot of general psychiatrists. I come from a background in general psychiatry. However, I see people at their worst. It can be a whole range of different problems. It can be a social crisis that's causing distress. It could be major psychosis. It could be a major depression with prominent agitation. And in some ways, it's quite difficult within that crisis situation to know when's the best time to offer people an alternative to medications, because often many people require medications in the acute setting to try to dampen down symptoms. But the first person I ever treated in the NHS, because I trained with Dr. Georgia Eade a number of years ago in using ketogenic metabolic therapy for major mental illness. And so I'd already done this training. I knew what was involved. I knew how changing diet could impact on the different psychiatric medications. And so the first person I came across in the NHS had actually been with our team for 7 months, which is almost unheard of. So it's a very long period of time to be in a crisis service. Usually it would be 2 or 3 weeks on average. And this was somebody with a bipolar diagnosis who'd had a severe depressive episode that had been going on for that length of time. And they hadn't been able to tolerate the standard medications and were on other long-term medication that just wasn't making a difference in terms of their symptoms. And I had to mention to her on several occasions that this was another option if she wanted to explore it. And in the end, she did. And I saw her come out of a severe depression that had been ongoing for 7 or 8 months at that point within 2 weeks of making a dietary change. It was, and in fact, there was, I forget the exact, I would say 70% improvement in her mental health within a week of adopting that dietary change, and then up to about 90% improvement within the 2 weeks. And I've seen this multiple times over now. So people coming out of severe episodes very quickly, but it's dependent on them being able to change their diet and follow the advice, which isn't always the easiest for some people.
That's incredible to hear that someone who's been in a crisis situation for that amount of time and then experience such a drastic improvement from a change of diet, because that brings me on to sort of the next point, really, that I think society in general is becoming increasingly aware that changes in diet can have a direct impact on quality of physical health. But I still think that the knowledge of how it connects to mental health is not so well known. And I think we're living in times where, I mean, for the first time that I can ever remember, I find myself with people I know socially who are saying to me, I feel really down. I'm experiencing chronic anxiety every time I try to leave the house. And I've never experienced that. This is what people are telling me. It reminds me of quite a humorous title chapter to one of the chapters in your book, which was Leaky Guts, Leaky Brain. So could you sort of break down for us a little, Rachel, about why different diets have an effect on our mental health? And specifically, I think with depression and anxiety as sort of chronic issues in society at the moment, could you explain why you think changes in diet could have a potential impact on those two conditions for us?
Yeah, of course. So even if somebody isn't necessarily that motivated to implement a very low carbohydrate diet, often what I suggest to people is to maybe consider excluding gluten, because we know that gluten in the gut interacts with the intestinal cell wall. And the intestinal wall is a single cell layer, and there are gaps between each cell known as tight junctions. And we know that a protein within gluten interacts with these tight junctions to open up the gut barrier. And when that happens, it leaves you vulnerable to essentially setting the scene for an autoimmune response or an autoimmune disorder. Although sometimes this will come out as symptoms of mental health, because if you have a leaky gut or increased intestinal permeability, it means certain toxins from bacteria can leak across the gut barrier into the bloodstream. And then this in itself sets a rise to an immune system response in the body. And we have immune cells in our brain that can become activated if the immune system more generally is activated. And when those cells in the brain are activated, it can cause inflammation, essentially. This is why you can end up with symptoms of different mental disorders if you have inflammation in the brain. The main advantage of being in nutritional ketosis, so this would be using a ketogenic diet, which is essentially reducing carbohydrates to a very low level, often below 20 grams per day. This shifts your body's metabolism into moving from burning glucose to burning fat as its main fuel. And one of the fat breakdown products are known as ketone bodies. And we know that these ketone bodies can cross the blood-brain barrier, get into the brain, and they actually provide a cleaner fuel source for the brain than does glucose.
Right.
And we know that they help to modulate inflammation and can help to correct some of the neurotransmitter imbalances that can happen. And these typically aren't the ones that we tend to think of, such as serotonin, but more there's a pathway called the kynurenine pathway. And this relates to GABA, which is an inhibitory neurotransmitter, and glutamate, which is an excitatory one. And often many mental health disorders relate to having too much glutamate, which is inflammatory and causes cellular dysfunction at that level in the brain, but also neurodegenerative disorders as well. So there's a situation called, it's a big phrase, but glutamatergic excitotoxicity is one of these big medical terms, but basically just too much of the gas pedal and not enough of the brake pedal in the brain. And we know that ketone bodies can normalize this pathway to restore balanced levels of these two neurotransmitters. And this is part of the reason why ketogenic diets have been so effective for treatment-resistant epilepsy for the past century. So this is obviously another brain disorder, but for whatever reason, we're only just catching up in the mental health field because neurology have been using ketogenic diets for treatment-resistant epilepsy, where drug treatment hasn't been good enough to control symptoms, and they've been doing that for the past century, whereas we're only really now catching up in the field of mental health.
Oh, that's fascinating. So am I understanding correctly that as well as having autoimmunity within the body, that we can also experience autoimmune conditions within the brain itself? Am I understanding that correctly?
Yes, because we have immune cells within our brain, so they're called microglial cells. They become activated, and there's an inflammatory form that they're activated in, or an anti-inflammatory form. And there's even research showing that environmental pollution, so like exhaust fumes, can activate these immune cells in the brain. And so there's some interesting studies showing that rates of suicidal thoughts are increased in highly urbanized areas where there's a lot more pollution, for example, than the more rural areas. So there's all sorts of different environmental factors that can also be relevant to brain health as well.
And is that where quantum biology might come in? I mean, what is quantum biology?
It's a completely different way of thinking. It kind of views the body more from a cellular and an atomic perspective. And really, we're talking about the communication within the body and energetics and electrons, protons, kind of getting down to that level of communication in the body. But essentially it focuses a lot on mitochondrial health, which is also the perspective that ketogenic diets would come from, because we know that ketogenic diets have a positive impact on our mitochondria. And we know that the brain is absolutely loaded with mitochondria, and mitochondria control all sorts of essential functions in the brain, including neurotransmission. So just the chemical communication that happens within the brain and the health of our neurons, everything really.
So running off of fat rather than glucose, can that affect the way our brain perceives things and the way that we potentially feel about things?
Well, absolutely, because I think if you're no longer dealing with an inflamed brain, so inflammation within the brain, then that means brain fog and concentration difficulties tend to melt away, is my experience of what it does for people. And we know that people with dementia, for example, when they can have ketones on board to lower inflammation, this can also reverse some of the cognitive dysfunction, so the memory type issues that those people have.
And I'm aware from sort of following your work, Rachel, that you're very sort of keen on circadian rhythms, blue light prevention. I've not seen you so far talk about sort of hot and cold therapies. I don't know whether that's something that you think is valuable or not. A grounding, I believe you're a fan of. Could you talk to us a little bit about what things like grounding, blue light, having a balanced circadian rhythm, how these things can impact on our mental health as well?
Yeah, of course. So you don't have to go very far in the research literature to find studies that implicate dysfunctional circadian rhythms with an increased risk of all mental health disorders across the board. And this is because circadian rhythm dysfunction leads to mitochondrial dysfunction, and one can make the other worse, and so on and so forth. And our neurotransmitter pathways essentially run on light. It would be the quantum way of looking at things. So, for example, serotonin is produced from tryptophan as an amino acid, and there's a certain spectrum of light that actually activates that pathway in the brain that sets off all the signaling pathways. And it's not just the neurotransmitter, it's our stress hormones. And so the one thing that blue light does is we have photoreceptors in our eyes that signal to our brain and to the master body clock in our suprachiasmatic nucleus in the brain. If you're in front of a screen all the time and on computers, phones, but also the energy efficient lighting that we use these days, they're very blue light dominant. And if you're not getting the natural spectrum of outdoor light, as so many of my patients tend to do, because often people are isolating themselves indoors and not getting outside, then you're just getting a very skewed signal to the body about what time of day it is, because you're blasting it with blue light, and that essentially signals to the body that it's sort of 12 noon in the middle of June. And so your body ends up having this huge cortisol response and cortisol spike that's not necessarily appropriate for your environment or time of day. And this is why people get into the realm of having nervous system dysregulation, which is also very common when it comes to mental health disorders. Sleep is absolutely vital for a whole range of different mental health diagnoses. I mean, it's vital for everybody to get good sleep because our brain detoxes at night when we're in deep sleep. And these environmental toxins we were talking about earlier, it's important to try to let the brain detox, rest and repair. We've known for many, many years that sleep is often one of the first symptoms when somebody's about to experience a mental health crisis, or it's often the thing that goes if somebody's dealing with anxiety or depression or schizophrenia episodes, all sorts of different diagnoses. And one of the main problems these days is artificial light at night suppressing our own melatonin production, which is what we need to be able to sleep well. So that's just a quick summary.
I'm quite conscious that not everyone, of course, but lots of people now spend several hours in front of a computer screen. They might be watching TV, or they're watching a movie, or, scrolling through social media or YouTube. What preventative steps can they take, if any, to limit their blue light exposure?
Yeah, so I personally like people to wear blue blocking glasses in the evenings if they're going to be on screens or around artificial lighting. So that would be orange lens blue blocking glasses to block all the artificial blue light. And certainly in my practice, I've seen that improve sleep quality for a lot of people. There are interesting studies showing that, for example, in mania, in bipolar disorder, there are a few studies showing that you can bring somebody out of mania by putting them in a dark room and using dark therapy so that they're just not having any light stimulation. So that's always really interesting, I find. But just taking steps to mitigate if you're going to be spending the evening on the screen, although ideally it would be great if people weren't on the screens all evening, or certainly limiting it to an extent.
You mentioned the blue blocking glasses. People have to be careful about where they're buying these from to make sure they're authentic. And are there any manufacturers or retailers that you would perhaps recommend to people?
Yeah, so you've got to be careful because some of the cheaper glasses available online is a bit hard to know how effective they actually are. So a retailer I like in the UK is called blockbluelight.co.uk.
Yeah, I'm familiar with
And
that.
they actually do a range of circadian friendly bulbs as well. So you can get into changing the color of your light bulbs after dark if you want to do that. Or sometimes just using incandescent bulbs because those still have infrared in them can be more circadian friendly.
Do you wear the blue blockers yourself?
Religiously, yes.
How do you judge when it's time to put the blue blockers on? Is it literally as the sun goes down? So you would literally time it with the sunset, and you would start wearing them from that point onwards?
Yes, pretty much. Yeah. That's a good indicator.
Excellent. And may I ask about grounding as well? How you think that assists people?
Yeah, so there's some really nice papers out there and also podcasts where others talk about this, but grounding can have quite a profound impact on the nervous system response in the body. So it helps to shift the body's nervous system state into more of a parasympathetic rest and digest state as opposed to the sympathetic fight or flight. But it also lowers inflammation throughout the body. And so there are studies out there showing thermal scans of inflammation and showing that after 40 minutes or thereabouts of grounding, there's a widespread reduction in inflammation. And that can only be a good thing in my book.
Do you ever use the hot and cold therapies? Did you feel they're beneficial?
Oh, yes. So I love sauna. And this is for a number of different reasons, partly to mitigate against a lot of the environmental toxins. So a lot of these toxins come out in our sweat, but mitochondria love far infrared, which a lot of the saunas tend to be because it helps optimize mitochondrial function. And it can also be very relaxing for people. So I think that can be very nice as well. I think the cold therapy absolutely has a role. Before I go on to that, just the sauna, there are interesting studies from, it's either Norway or Finland, where they've shown that actually your ultimate risk of dementia and psychosis appears to be lowered in the people who are doing more regular sauna, so using between 4 and 7 saunas per week, as opposed to people only doing 2 or 3. And obviously sauna is more naturally a part of that culture there. So that was quite an interesting population study that was published. And so I think that just shows the impact that these environmental toxins can have on our brain health. And then the cold therapy can be helpful because it massively boosts dopamine and noradrenaline production within the body. And a lot of psychiatric disorders, particularly the ones where people are very slowed up, you could think of as being almost dopamine deficiency states. But there's a bit of nuance around the cold therapy. So if somebody has a lot of nervous system dysregulation, it's not necessarily the thing I would say jump straight into. It certainly can be therapeutic. And yeah, both of these modalities are definitely quantum aligned.
Okay, so I'm very conscious of your time today because I know you have a busy day. So before I ask you about where people can find more information about your work, I have a signature question that I like to ask everyone that onto the show. And that question is usually the same question for everyone, but if it's okay, I'm going to modify yours slightly. So the question is usually, if you could recommend that people do just one thing to improve their health, what that recommendation would be. Now, because you're a specialist in mental health, I would like to just modify it slightly by asking you, if people can only do one thing to improve their mental health, what one recommendation would you make to them?
Oh gosh. Yeah, I'm torn between two, but I think it would come down to just getting outside more, and particularly getting outside in the mornings to try and get some of that morning light. And it's because your brain and your body clocks need to know where you are in the world and what time of day it is. And if you have circadian rhythm dysfunction, it's very difficult to correct that without getting that natural light.
Okay, so are you suggesting that it's beneficial for people to get up in the morning with the light? So at the moment, people may be getting up at 4 a.m. You feel that is beneficial?
It depends on the level of circadian rhythm dysfunction. So sleep is also important. So I want people to get enough sleep. This time of year, it's difficult because sunrise is so early, but even getting out an hour or so after sunrise. I think there's a lot of value that you can gain. And doing that without wearing glasses or contact lenses that block part of the light spectrum. So that would be my top tip, is just to get outside and to not keep pressing snooze or rolling over in bed, basically.
Fantastic. So, Rachel, may I ask if the listeners are interested in finding out more about your work, is there a website that they can go to for information, social media? And also, would you like to tell the listeners where they can buy your book if they'd like to?
Sure. So the book's on Amazon. It should be fairly widely available. My website is drrachelsbrown.com, and then I'm on social media on Instagram as Carnivore Shrink.
Rachel, thank you ever so much. I'm hoping that you may be at one of the clinics or conferences that are being run in this space later in the year, because I'd very much like to thank you in person for your time today. It's been an absolute pleasure, and
thank you.
Hope to meet you in person at some point soon.
Yeah, probably October, I'm guessing.
October, I will be at the Keto Brain Health. Yeah. So yeah, it would be great to meet you in person.
Yeah, likewise.
Thanks again.
Great.
Do take care, Rachel. Thanks.
You
Bye.
too. Bye.